Hello everyone, I'll be presenting a video on very hard cataract with suspected generalized weakness of zonules in a 8-year-old female patient after staining the capsule with tryptophan blue. Now I'm entering the chamber with 2.8 keratome. Now you can see that as the patient has anterior insertion of zonules, you can see that a small bubble got trapped probably within the zonules. So initiating the capsulorrhexis, you can see that while initiating the rhexis there was capsular wrinkling, suggesting that the zonules could be quite weak. But I continued with my cystitome and rest went on good. I did not find much of resistance or difficulty during completing the capsulorrhexis, but the initiation was a little bit challenging. So now doing hydro after removing some of the viscoelastics from the anterior chamber, doing hydro dissection. You can see the fluid web, tapping to remove the fluid which is trapped behind the nucleus, checking for the nucleus rotation. Now introducing my sharp chopper, starting my Phaco emulsification. After doing a short trench in the center, started chop with the settings shown here. The nucleus will be chopped in 6 to 8 pieces. The cataract was relatively harder. The machine that I am using is your Constellation machine from Alcon. No financial interest. So after the chopping has been done, I'll start my emulsification now. So before that I replenished with viscoelastics and then continued with quadrant emulsification with the settings as mentioned here. Each nuclear piece will be held and it will be emulsified in the safe zone at the iris plane. So now you can see that the last piece is also being emulsified. And a small piece which was hidden under the dense arcus also came out and was also emulsified. So now it's time to do the cortex removal with bimanual irrigation aspiration system. Till now I did not find any weakness of the zonules. Bag was looking to be quite stable. After polishing the undersurface of the lens capsule from one side, I shifted and removed the cortex from the other side. Hydro polishing of the posterior capsule was difficult because the PC was quite floppy, suggesting generalized weak zonules. So you can just see consider on the margin. Now the margin is rounded, and after IOL implantation, this is the plate haptic IOL, foldable IOL. You can see that there is ovalization of the capsulorrhexis margin as compared to the picture on the left side. So I feel that ovalization of the capsulorrhexis can be a sign of generalized weakness of the capsular bag, as the outward zonular stress is less, the overall capsular diameter is reduced, and when the IOL is placed in a small bag, there is stretching and ovalization of the rhexis margin along the long axis of the IOL. The effect is more in cases with your plate haptic IOL as compared to C-loop IOL, as the haptics are quite stiffer. But the patient did well in the post-operative period. Thank you for watching.